Hi there. This is Dr. Paul Chung. I wanted to start recording these videos for the parents of my patients. So if they wanted to, they could watch them beforehand to get an overview about what we'd talk about. And then if they did so, then they could kind of listen as much as they wanted to and understand some of the main concepts. So if there were more intricate questions or specific questions about what's going on with their child, then we would have even more time to focus on those issues during the well child check appointments. So for this video, I'll go over some of the main topics that I usually discuss with the parents at the first newborn visit. And the first newborn visit is usually going to be within 1 to 3 days after discharge from the nursery. And one of the reasons why we do that more expediently is to ensure there aren't significant weight loss issues that we need to track. It's common to have some weight loss, but we want to make sure that it's not too much and to make sure there aren't rapidly rising jaundice levels. And again, it's common to have some level of jaundice, which is a yellow tinge to the skin or eyes, and we want to make sure that that issue is not rising too rapidly. So when you're discharged from the nursery, the newborn pediatricians that round on all the newborns will give you some guidance about when the optimal day of the first newborn outpatient follow-up. They will give you some guidance about when the first appointment with the pediatrician should be. And so they may say something along the lines of the first follow-up appointment should be day after tomorrow, or they may say something along the lines of it's safe to go home, but since this issue is a little bit more borderline, so it would be safer to be seen the day after discharge. And then you would just call us to make that first follow-up appointment at that time. So some of the main topics for that newborn visit is going to be first revolving around appropriate and recommended feeding, signs of hydration, and symptoms to monitor for to ensure that you don't need to come back before the next scheduled appointment. So we, of course, encourage and support breastfeeding because there's so many potential benefits for the mother and especially potential benefits for the newborn and growing child, such as decreased incidence of allergic diseases, such as eczema, decreased chance of different infectious disease such as ear infections, RSV, and other conditions such as SIDS. Therefore, if a family is committed to breastfeeding, then we will support them in that decision as much as possible. Initially, until the newborn becomes more vigorous and their stomach is getting bigger and they're getting more efficient with the feeding, we say to feed frequently enough. So we say feed a minimum of 8 times per 24 hours. Within that minimum of 8 times per 24 hours, there's flexibility in how often you feed your newborn. It can just be on demand whenever they seem hungry, every 1 to 3 hours, for example. And the rough estimate of how many times you're going to need to breastfeed is going to be approximately 8 to 12 times per 24 hours. And the rough estimate that we give for how long or the duration of breastfeeding, we say aim for approximately 15 to 20 minutes each breast per feeding. So as your newborn gets older, they'll become more efficient and vigorous with the feeding, and you won't necessarily have to feed that duration for weeks moving forward. But until they become more vigorous, that's the duration that we recommend, approximately 15 to 20 minutes each breast. When you have your infant latch, one of the things we recommend is the following. Every newborn has a rooting reflex where if you touch the side of their mouth with your nipple, then they'll turn toward that side and open their mouth to root or suckle. And so we say do something along those lines and then try to time it, wait until he or she opens his mouth nice and wide and almost shove or kind of place the whole areola into your newborn's mouth so they're suckling and attaching on the whole areola nipple and not just the nipple. And that will be a better latch and help prevent nipple pain or irritation issues. Each time that you continue this relatively frequent breastfeeding, there will be neurologic feedback to the mother's brain to release more milk producing hormones so that the milk production hopefully is slowly increasing each day. And we commonly see where if the milk production isn't that robust initially, we commonly see that around day 3 or 4, the milk production and the latch and the suckling and how well your infant is feeding is getting better and better. And the milk a lot of times comes in more robustly on day 3 or 4 of life. Initially, it can be common for your newborn to be sleepy and need some encouragement and kind of waking up sometimes if they're falling asleep every time they feed. And things that you can do to try to encourage them to feed would be to rub their back, maybe gently flick their toes, something along those lines to arouse them if it's time to feed. And while you're waiting for that to happen to become more vigorous feeders, if they're not doing that yet, then it can, in some situations, be helpful to use an electronic breast pump like the Medela or Spectra brand to mimic the infant suckling at the breast, and that can help stimulate milk production. So just like what happens when your newborn is suckling, that breast pump motion, again, will send neurologic feedback to the mother's brain and hopefully release more milk producing hormones. I try to avoid telling a mother in that type of situation to do too much. We try to avoid saying, have your infant breastfeed for this duration, then pump right after, then whatever milk that you might be getting, feed that breast milk from the bottle. And so if we tell you to do that type of triple feeding practice, then there's zero time for potentially the mother to get some sleep and rest and get hydration and nutrition and whatever else she needs to do. So I say to use the breast pump as much as you want. You might not need to use the breast pump if the breastfeeding is gradually improving. If you feel like you want to use it, the timing of when we say to use it is to use it after your newborn has breastfed or in between, not right before. We don't want to drain your breast of the milk that might be available for when your newborn starts to breastfeed for that session. So you can use the breast pump, and I say to use it as much as you want. No pressure to do it so much that you're getting overly exhausted. If a newborn is bottle fed, for different personal reasons, or while you're waiting for the milk to come in, you decide, I want to do some amount of bottle feeding, whether it's formula or whether it's breast milk, then initially during the newborn period, we estimate that they'll take approximately 30 to 60 milliliters at a time, which is 1 to 2 ounces at a time. Now, you don't have to follow those numbers every time you feed your newborn if you're doing some bottle feeding, and you can just follow his or her hunger cues, meaning you give the bottle and you give as much as he or she wants until it seems like they're full or disinterested. They fall asleep, or even with gentle encouragement, they don't want to feed anymore. They're just seem disinterested and turning away. And that tells you that for that specific feed, your newborn is full, and then you can just stop at that volume, whatever it might be, and then offer the bottle again later, or the breast. And if you do some of this bottle supplementation in conjunction with breastfeeding, then the timing that I recommend to do it is after you breastfeed. So if the breastfeeding is not that robust or going as well as it will later, then you could breastfeed for a shorter time to not overtire yourself out or overtire your newborn out. And until the breastfeeding is improving, you could do something along the lines of breastfeeding for 10 minutes on each side, and then top your newborn off with the bottle and let them take however much they want. How much they want will differ depending on how much they got from the breast, so you don't have to follow certain numbers. Again, they're pretty good at telling you how hungry they are and telling you if they're full, and so just follow their hunger cues and feed until they seem disinterested for that feed. When you're using the breast pump, if you're initially getting just a few milliliters or less at a time, that gives us some information that the breast milk production is not that robust yet. And in some situations, it may be helpful to do some formula feeding. But if the breastfeeding is going better and better, then you might not need to. If when you use the breast pump, you're getting more and more milk, eventually 5, 10, 20, 30 milliliters, then that tells you that the breast milk production is more robust, and therefore it's more likely that when you breastfeed, that your newborn is going to be getting more and more milk. These are the signs that we look for that the breastfeeding is improving in the way that we hope, which commonly can happen after 12, 24, 48 hours. So the signs that we look for is that the mother subjectively feels that their breasts are becoming more full. They feel more let down, meaning after the newborn feeds, they feel like their breasts are more emptied. We hear more gulping noises as the newborn suckles. We see more milk on the side of their mouth during or after the feed. And we also can get some information for how many times they're peeing. I tell parents that you do not need to count how many times your newborn poops per day because there isn't a normal number and it varies from day to day, week to week, and from infant to infant. The peeing can be more helpful for tracking feeding and hydration status. So commonly, a newborn is expected to feed maybe initially about the number of times as they are days old. So it'd be a reassuring sign if your newborn pees at least once the first day of life, at least 2 times the second day, at least 3 times from 48 to 72 hours old. And then after 3 to 4 days old, good hydration is suggested by a newborn peeing at least 4 times per 24 hours. So if your newborn is gradually peeing more and they're peeing more than that, then that would be a sign that if you're breastfeeding or whatever way you're feeding, is that they're getting enough milk. Transitioning to a somewhat different topic, every newborn should be on once a day vitamin D supplements. Breast milk has all the nutrition that your newborn needs, except maybe enough amounts of vitamin D. So we recommend just go to the newborn section of any pharmacy, and they will have vitamin D supplements. A commonly available brand is an Enfamil brand, and they have something called D-Visol, D/VI/SOL, or Tri-Visol. And the Tri-Visol has 2 other vitamins that aren't necessary. So choose either of those. There'll be instructions on there to just squirt that into the side of his or her mouth. It comes with a dropper. It'll say 1 milliliter once per day. And so that's the standard 400 units per day that every newborn needs. It is acceptable to use a different brand, but pay attention to the instructions because a different brand might have a different concentration where the standard 400 units per day might be 1 drop. So follow the directions to the standard 400 units per day. And we recommend continuing that for the whole first year at least. And we recommend just starting that sometime within the first week or so. After the first newborn appointment, which we do within 1 to 3 days after discharge, usually within 1 to 2 days, after that appointment, usually the next appointment is approximately a week and a half later. So we standardly do a 2-week-old weight check. We will adjust the timing of the next necessary checkup depending on the needs of your child. So if there are some mild but not concerning jaundice issues, then if we do the blood test and it suggests we need to check it over the next 2 days, then of course we will check it whenever day is necessary. If the weight loss that we see at the first newborn appointment is borderline or more than expected, then of course we will recommend following up in a timely manner within the next few days to ensure that that weight loss period is plateauing and it will track that the weight is coming up slowly. And it's a good sign if your newborn regains their birth weight by around 2 weeks old, which we'll be following all those things with you. Once we decide on the next recommended weight check follow-up appointment, the signs or symptoms at home that would suggest that you shouldn't wait to that appointment and be seen sooner include the following. You do not need to check your newborn's temperature regularly. If you do check it, the most accurate is going to be rectal. The second most accurate, I would say, is a tympanic or ear thermometer, and it's optional whether you purchase an ear thermometer or not. But the most accurate would be a rectal. If you have some concern and you do check the temperature, then too high, which is technically a fever, would be 100.4 or above, 38 degrees Celsius or 100.4 or above. And in this age group, if there is a fever like that, then you should present to the emergency room right away. So that would be one sign, would be a fever. Another sign would be if you just by looking at your infant in under some good lighting at home feel like it's pretty obvious that the yellowness to his or her eyes or skin is more pronounced, then you shouldn't wait till that follow-up appointment and just to get an appointment for that day to be evaluated on that day. Uh, the jaundice or yellowness, if it's progressing in an infant's body, it will start to appear on the whites of the eyes and then the face, and progressively, as it becomes more pronounced, go down the body. And we don't expect parents to be good at being able to tell that. So if you're concerned, then after the newborn visit, you can go home and under a certain lighting, kind of try to store it in your way in your head. This is what is right now expected and okay. And then once a day, you could just look again. And if it seems obviously worse to you, then please bring them in that day to be evaluated. If the clinic isn't open, then emergency room would be appropriate. And one of the other signs would be if they're not peeing enough, like I had verbalized. So after 3 to 4 days old, we expect at least 4 pee diapers or 4 wet diapers per 24 hours. If they're concerned with the feeding and they're not doing that much, then maybe worth it to make an appointment and have them evaluated. If I were to mention other symptoms that may be a red flag for illness, one would be being inconsolable. Crying is one of the only ways a newborn can communicate initially. So crying because they're hungry or because they have a full diaper or they're calling or whatever reason, or due to gas, crying is expected. And usually they can be consoled with some rocking or picking them up or changing their diaper or feeding. And then maybe when you put them down, they cry again. But if they're consoled by you soothing them, then that's normal. So consolable crying is more reassuring. If an infant is inconsolable for something along the lines of more than 1 to 2 hours straight, where no matter what you do, trying to calm them and soothe them and rock and hold them and make them cozy in a blanket, no matter what you do, they're inconsolable for more than 1 to 2 hours straight, then that can also be a warning sign indicating more severe illness. But if they're consolable, then not nearly as worrisome. Those are some of the main points I like to go over during the newborn visit. And the next video will be discussing the 2-week-old weight check. And that's it for now. Thanks, everyone.